Today we will see the anterior lateral column of the ascending tract of spinal cord. In the previous lecture we discussed the dorsal column of the ascending tract of the spinal cord. In the dorsal column, the sensory nerve fibers, it will enter the dorsal root of the spinal cord and it will meet the first order neuron, and most of the sensory nerve fibers will go to the dorsal column and it goes upwards without crossing and on the same side, that is ipsilateral side. And we also discussed that dorsal column, in dorsal column it is mainly responsible for the very minute detail, since it has only the ascending tract in dorsal column and there are no descending tracts. So in dorsal column you have the fine touch, the sense of position. I mean the overall body, where are your hands and legs, your head, you are aware of the position, and the sense of vibration, the sense of 2-point discrimination, and the localization of the senses, that is the spatial orientation, and the line and lane principle proprioception. Here anterolateral column, the primitive system, it has the crude touch, and mainly the sensory nerve fibers passes through are the pain and temperature fibers, tickling sensation, itching sensation, and sexual sensation. These are all very old feelings, or we can say old system. So dorsal column, the sensory nerve fibers are more myelinated, and the velocity, the speed of the signal is very fast, that is it has fast velocity. In anterolateral column, the nerve fibers are less myelinated and it has slow velocity, poor localization, and poor line and lane principle, because in anterolateral column you have both ascending tracts and descending tracts. The descending tract means the tract from the cerebral cortex to the rest of the body, it is descending tract. We have discussed the sensory nerve fibers most of it go to the dorsal column and some of it go to the anterior and lateral column. So here we will see in anterolateral column, the sensory fibers, as usual like the dorsal column, it will first meet the first order neurons, and some will go to the lateral side and some will go to the anterior side. So here we will discuss the pain and temperature pathway, how this pain and temperature fibers pass through the anterolateral column. We know that in peripheral nerves there are 3 types of fibers: A fibers, B fibers, and C fibers. The A fibers are highly myelinated, B fibers are less myelinated or lightly myelinated, C fibers has no myelination. Please note that C fibers has no myelination. In A myelinated fibers, in the A type, you have 4 subtypes: alpha, beta, gamma, and delta fibers. What are these myelination I am talking about? These myelination are, we have discussed this in the previous lecture, that the axons are covered by a layer of myelinated sheath. In peripheral nerves, some axons are myelinated, some nerve fibers are myelinated, and some are lightly myelinated, and some nerve fibers has no myelination, and it is because each nerve fiber has a different function. So this delta fiber of the type A myelinated fiber, it is related with the transmission, that is transport of fast pain. And this C fiber, that is it has no myelination, this fiber is related with the transport of slow pain. So now what is the difference between fast pain and slow pain? Fast pain, for example, pin prick pain. When someone attacks you with the needle, what happens? You will feel the pain immediately and you will take your hand within a second. That is, this fast pain happens within a second. But what is slow pain? Slow pain, the pain, it will come after 1 hour, 2 hours, or more than 1 hour. These are slow pain, such as dull pain, throbbing pain, and burning pain. Example for the dull pain is if you do a workout, that is if you do intense exercise, you will have the muscle pain. But this muscle pain, it is all over the muscle, it is diffuse. You cannot point out exactly where this pain is coming from. So this is an example. And another example is if you have an stomach pain, you cannot exactly point where the pain is coming from. It is when you ask the patient, he will say the pain is coming from all over the abdomen. So these are examples for slow pain. This fast pain is only from the skin, and this slow pain, it is from the skin and the tissues. So in fast pain, you have the mechanical stimulus and you have also the thermal stimulus. What is the mechanical stimulus? For example, if you use a pin, if you prick someone with a pin, this is a mechanical stimulus. What is a thermal stimulus? If you touch a hot vessel in the kitchen, what happens? You will immediately take your hands off. So in slow pain, it has mechanical stimulus, thermal stimulus, and chemical stimulus. So what is this chemical stimulus? For example, let us go to the mechanism of pain, how this pain is coming in your body. If you have an injury, or we go back to the workout, if you do an intense workout, what happens? You will have a muscle pain. If you go inside the muscles, there are injury to the tissues. So these tissues, in these tissues, there are chemical substances produced in these tissues, such as 5-hydroxy, tryptamine, histamine, bradykinin, acids, and potassium ions. These substances, it will come in the tissues only when there is a injury, and it will give the inflammatory reaction. Because of these enzymes, you will feel the pain, it will increase the pain. So these are the chemical stimulus inside the tissues which causes the slow pain. And there are chemical substances in the tissues, it will less the pain, it will not decrease the pain, it will decrease the threshold of the pain. What do you mean by threshold? It will decrease the intensity of the pain. Without this substance, you will have only an increased pain, and you won't be having a decrease in the pain. So what are these substances? Prostaglandin and substance P. So these substances are also produced in the area of the injury, so that you will not suffer the very high pain. These substances, it will decrease the threshold of the pain, so that you can capable to hold the pain for a long time. Because without these substances, there are persons who might die of the high threshold of the pain. And here these fast pain and slow pain nerve fibers are coming from the receptors which are located in the free nerve endings. So what are these free nerve endings? We have discussed earlier in previous lecture. There are free nerve endings in the skin, and there are receptors in the free nerve endings that can sense the pain and temperatures. And here the A delta fibers carry the fast pain, and the C fibers carry the slow pain. And also note down this: the thermal receptors, the nerve fibers, sensory nerve fibers from the thermal receptors which carry the temperatures such as cold, warm or hot, they go along with these pain fibers. So wherever these pain fibers go from the spinal cord to the cerebral cortex, these thermal fibers also go along with the pain fibers. That's why when you have an injury, you will either have a fast pain within a second, or you will have a slow pain after 1 hour or after 30 minutes, like that. And if there is a pain, some will have a feverish like condition also. This is because these thermal fibers are along with the pain fibers. That's the reason. And the substances, chemical substances produced during an injury inside the tissues. Here this potassium, you see this potassium inside the cells. So a tissue is made up of a group of cells. So whenever there is an injury in the tissue, what happens is this potassium inside the cells, it will leak and it will go into the interstitial space. So that's how these substances cause the pain. Let us go to the anterolateral column here. So here the nerve fibers from the free nerve endings in the skin, this A delta fiber carrying the fast pain, it will go to the dorsal root of the spinal cord. It will first meet the first order neuron in the dorsal root ganglion, and it will enter the spinal cord. And this C fiber carrying the slow pain, and also from the free nerve endings, it goes the same. These fast pain fibers, after entering the spinal cord, they will immediately meet the second order neurons within the spinal cord, and from the second order neurons, these sensory nerve fibers will go to the lateral system and go upwards, and this sensory nerve fibers going upwards, it will go to the thalamus. So the name of this tract is lateral side, lateral system, and going to the thalamus from the spinal cord. So the name of this tract, because these sensory nerve fibers will form a tract eventually as did in the dorsal column. So the name of the tract is laterospinal thalamic tract. And the slow pain fibers, it will also meet second order neurons, and it will go to the anterior side, anterior system, and we will discuss this later. Here these fast pain fibers, if we take one neuron and it is connected with one secondary second order neuron, and the information is transmitted through the neuron to the lateral side, and it go upwards to the thalamus. But here in the slow pain fibers, if we take the one neuron, it meet one secondary neuron, second order neuron, and there are branches, and from the second order neuron, the sensory nerve fiber, it will divide again like branches, and it will go to the anterior side. So what is the name of this tract going to the from the anterior side to the thalamus? It's simple, anterospinothalamic tract. If it goes through the lateral side, it is lateral. If it goes through the anterior side, it is anterior. Because of this one-to-one meeting point and there are no branches, the fast pain is transmitted within a second, and exactly we know, because of this we exactly know where the pain is coming from. And because of this so many branches from the slow pain fibers, we don't know the exact position where the pain is coming from, and also it will take time for the pain to come in our body. Because of this, the pain may come more than 5 minutes, 30 minutes, 1 hour or 2 hours. So this is the mechanism inside the spinal cord. In the dorsal column, we have seen that the sensory nerve fibers are arranged in a topographical manner. That is, the sensory nerve fibers from the lower part of the body, it will go medially, and from the upper part of the body it will go laterally. So we have seen the topographical arrangement of the sensory nerve fibers in the dorsal column system. Here in this anterolateral column, the second order neurons here, these are arranged in a pattern known as dorsolateral tract of Lycia. So why do we call this as dorsolateral tract of Lycia? If you take 3 spinal cords, you can see you will have the second order neurons in the dorsal root like this. So they are arranged in this position. Since they are near the dorsal side of the spinal cord and lateral side of the spinal cord, these are the lateral side and this is the anterior side, these are named dorsolateral tract of Lycia. So these are the free nerve endings, and these free nerve endings meet the second order neurons, both the A delta fibers and C fibers. When both the A delta fibers and C fibers meet their respective second order neuron inside the spinal cord, let me zoom this for you. The meeting area between the fiber and the second order neuron is known as substantia gelatinosa. Substantia gelatinosa, and this area, it plays an important role in the modulation of the pain, and in this area there are substances produced in this area, either it will decrease the pain or it will increase the pain, and we call this in this area as a gate for the pain pathway. Either it will increase the pain or it will decrease the pain. Let me zoom in for you the dorsolateral tract of Lycia. Here this A delta fibers, it will meet the second order neuron, and here the C nerve fibers, it will form the it will meet the second order neuron, and this arrangement in the whole spinal cord, we call it as dorsolateral tract of Lycia. And from the C nerve fibers, after meeting the second order neurons, from here only you will have so many branches. So we are talking about this arrangement of the second order neuron. This is known as dorsolateral tract of Lycia. Here notice that the sensory nerve fibers from the fast pain and slow pain, unlike the dorsal column, they go to the contralateral side and move upwards. But in dorsal column we have seen that the the sensory nerve fibers, it will go through the dorsal root, it will meet the dorsal root ganglion, that is the first order neuron, and most of it will go to the dorsal column and it will go on the same side upwards. You should note this here. And these sensory nerve fibers from the fast pain and slow pain, they form a tract known as lateral spinothalamic tract and anterior spinal thalamic tract. These tracts combine together to form a spinal lemniscus. We have seen medial lemniscus in the dorsal column. Where do you see the medial lemniscus? The sensory nerve fibers from the third order neurons in the nucleus cuneatus and the nucleus gracilis, they cross and go to the contralateral side and it forms a tract known as medial lemniscus located in the medulla oblongata. Like that, here the sensory nerve fibers, it will not cross, but it will meet the second order neurons and it will go to the contralateral system and move upwards from the lateral side and anterior side, and they are combined together to form spinal lemniscus. From the spinal lemniscus, the fast pain and slow pain fibers, they go to the nucleus of the thalamus. What is the nuclei? The third nuclei and the fourth nuclei, and you have the third order neurons in this nuclei. While going upwards, what happens is these sensory nerve fibers leak some signals to the reticular formation located along the brain stem. You can see this reticular formation throughout the brain stem, and this is known as collateral connection. We have seen in the previous lectures how this collateral connection plays a role in the activation of respiratory centers, in the regulation of respiration. So what happens when the signal goes to the reticular formation? From this reticular formation, the signal will go to all the cerebral cortex without missing any places. And also know that the pain fibers from the slow pain and the fast pain, they will go to the nucleus of the thalamus, but some slow pain fibers, they go to the internal thalamic lamina. Where is this internal thalamic lamina? So this is the hypothalamus. We have seen the structure of a hypothalamus, and you have the internal thalamic lamina. Inside the internal thalamic lamina, that is inside this Y shape, you have internal lamina nuclei. This internal thalamic lamina consists of white matter with gray matter. These slow pain fibers go to the internal lamina nuclei. We have discussed that the sensory nerve fibers from the slow pain and fast pain, it goes as anterior spinal thalamic tract and lateral spinal thalamic tract. There are also some other sensory nerve fibers, because we have seen here from the slow pain, after meeting the second order neuron, the sensory nerve fibers, it will divide into many branches. So from these branches there are some sensory nerve fibers. It will go from the spinal cord to the tectum. Tectum is located in the midbrain. So as it goes from the spinal cord to the tectum, it is known as spinotectal pathway. So where is this tectum located? It is in the midbrain. In the midbrain, there are two swellings you can see, such as superior swelling and inferior swellings, known as superior colliculus and inferior colliculus. This whole structure is known as a tectum. This spinotectal pathway also go through the spinal lemniscus and then go to the tectum. And there are other sensory nerve fibers from the anterolateral system. It goes to the Oliveri structure. What is this Oliveri structure? This Oliveri structure is located in the medulla oblongata, and this structure, it has only cell bodies of the neuron, that is, it is a mass of gray matter. And let us see the function of the different tracts. This anterospinothalamic tract, the function is crude touch. What is crude touch? Crude touch means if you touch someone with the palm of your hand, you will feel the sensation all over the hand if you touch with the palm. But if you touch with two fingers, you will see exactly where the two fingers are. So this exact sensation, it comes under the dorsal system. This palm touch, crude touch, it comes under this anterolateral system. So anterospinothalamic tract function is crude touch. And what is the function of laterospinothalamic tract? Passing pain and temperature. What is the function of spinotectal pathway? It is the spino-visual reflex. What is the spino-visual reflex? For example, if you are walking in a street and you suddenly stepped on glass pieces in the street, what happens? You will take your leg immediately from those glass pieces, and you will also see down what is down there. So this is spino-visual reflex. You not only take your leg off, you will also see what is happening down. So it is the function of spinotectal pathway. And what is the function of spino-oliveri pathway? It is the passage of proprioception, position, sense of position, sense of touch and pressure nerve fibers. You see here, this sensory nerve fibers from the anterolateral system, it goes to the Oliveri, and it will not go upward, it will go to the cerebellum. If you know the structure of a human brain, you have the brainstem here, medulla oblongata, pons, midbrain, and you have thalamus here. Here on both sides you have cerebellum, and this cerebellum is connected with the midbrain, medulla oblongata, pons through inferior peduncle, medial peduncle and superior peduncle on both sides. So this Oliveri structure is located here in the medulla oblongata, and the sensory nerve fibers go to the cerebellum through the inferior peduncle. We will discuss this cerebellum in a short while. Now we will discuss the continuation of the sensory nerve fibers from the third order neurons, that is in the third and fourth nuclei of the thalamus, and the continuation of the slow pain fibers in the intralaminar nuclei. So from the so here we have the another section of the brain, and here you have the reticular formation, thalamus, internal capsule, same like in the dorsal column system, the slow pain fibers and fast pain fibers it will go through the posterior limb of the internal capsule and then to the cerebral cortex in a radiating pattern known as corona radiata, and it goes throughout the cerebral cortex without missing any place. And some sensory nerve fibers from the slow pain fibers, it goes to the interlaminar nuclei and it goes the same to the cerebral cortex. And some sensory nerve fibers from the positive pain and slow pain, it goes to this structure here known as cingulate gyrus. It goes to the emotional cortex here. What is the function of this cingulate gyrus in this emotional cortex? It will modify the pain. Know that pain has a deep connection with our emotions. That's why whenever someone is injured, he or she will cry due to the pain. We will take two examples here. In the first example, you are getting beatings from a group of 4 to 5 people because they are beating your friend, and you finally protected your friend and you will have the proud feeling. There you will not have any pain. Of course you will have the pain, but the pain is very less. In the second example, you are getting beatings from the same 4 to 5 people because you did a mistake, and here in this example you will have a very severe pain. So this pain is modified according to our emotions in this cingulate gyrus, and the pain fibers from the slow pain and fast pain are also go to the insular cortex. In this insular cortex there are autonomic responses, such as when you have a pain, you will have increase in the heartbeat, increase in sweating, you will have nausea, that is vomiting like sensations, and some will vomit due to the severe pain. These are controlled by the insular cortex. So when your pain fibers from the slow pain and fast pain go to the thalamus of the nuclei, it goes to the cerebral cortex through the posterior limb of the internal capsule, and some it will go to the emotional cortex and some go to the insular cortex. And this particular slow pain fibers, we have already discussed that some will go to the internal laminar nuclei of the thalamus and go to the cerebral cortex. These pain sensory nerve fibers from the spinal cord, when it moves upwards, we have already discussed that it leaks some signals, that is action potentials, to the reticular formation. Now why this reticular formation is very important? Because the function of reticular formation is on and off switch of the brain. So on and off switch means this reticular formation is on during consciousness, that is during the daytime, and it is off during night time, that is when we are in deep sleep. This reticular formation also go to sleep. So from whatever signals it receives, it will be transmitted to all the cerebral cortex without missing any part. So in the frontal lobe, during daytime we are aware of our thinking, voluntary movement, and if it goes to the parietal lobe, it goes to the sensory sensation, and in the temporal lobe you have the auditory sensation. Occipital lobe, the function is visual sensation. So During daytime, you can even hear very minute sound very clearly. This is because of your very active reticular formation. But in night time, when you are in deep sleep, you cannot even hear any sound. Even when your parents are calling you, waking you up, or if your phone rings, or if they slap you in your face, you will not feel anything. It is because your reticular formation also sleeping in deep sleep. If the reticular formation is sleeping, it will not send any signals to the cerebral cortex. We already discussed that there are some slow pain fibers. They go to the intralaminar nuclei of the thalamus and it go to the cerebral cortex. Because of this, some slow pain fibers, what happens is, if you have a severe pain such as muscle pain, stomach pain, or any part in the body, if you have any pain, those are diffused. You cannot sleep during the night time. Know that the reticular formation is sleeping with you during the night time. Because of this slow pain fibers, the cerebral cortex is activated during night time and it will receive the pain sensation. That's why you cannot sleep during the night time, and this is the reason. So now what you will do for the pain? You will massage the area of the pain, or you will apply any cream or any spray in the painful area, and when you massage, eventually the pain will decrease. This is because we discussed earlier that in the spinal cord, in the dorsal root, your pain fibers enters. It will meet the first order neuron and it will enter the spinal cord and it will meet the second order neuron, right? And we have also discussed in the dorsal column system that the sensory nerve fibers enter the dorsal root, it will meet the first order neuron and it will go to the dorsal column and it goes upwards. Here, if you zoom it here, we already discussed this area, that here in this area is known as substantia gelatinosa. Here between the sensory nerve fibers in the dorsal column and the pern nerve fibers in the anterolateral system, you also have some connections, some branches from the nerve fibers, and in between the second order neuron and between these branches you have, what do you have? A connector neuron. So whenever you massage in the painful area, what happens is, you are massaging, you are giving a mechanical stimulus through the sensory nerve fibers going to the ascending tract in the dorsal column. So whenever you massage, whenever you give mechanical stimulus, this glutamate and substance P are produced through this connecting neuron. And what is the function of glutamate and substance P? It will block the chemical substances coming through the pain fibers. The chemical substances that are produced in the tissues, because of those chemical substances, the pain fibers are activated and coming here. These glutamate and substance P, they try to block this slow pain fiber and try to decrease the pain going to the cerebral cortex. This is what happens when you massage or put any creams such as liniment cream, or when you do acupuncture, or if you have any painkiller sprays. This is what happens, and this is known as gating theory. That is, here the external mechanical stimulus, they produce some chemical substances, and here there is a gate. Either it will block the gate or it will open the gate for the pain fibers. This is known as gate theory. We already discussed that the pain has a deeper connection with the emotional component of the brain. We already saw two examples when you get beatings. In order to protect your friend, you will have a proud feeling and the pain is very less. When you compare with that, when you get beatings alone for a mistake, it will be very high. So what happens here is, in the brain, if you have read the neuroanatomy chapter, you will know that there are structures in the brain, such as between the thalami you have third ventricle, and with the continuation of the third ventricle, below third ventricle you have the cerebral equator, and on the both sides below the third ventricle you have periventricular gray matter, that is the cell bodies of the neuron, and on the both sides of the cerebral equator you have periaqueductal gray matter, and below you have midline nuclei, that is the nucleus raphe. So when you have a proud movement, what happens is, there are fibers coming down from these structures and it goes and meet the pain fibers. Here is the pain fiber and the second order neuron, and it goes here to the pain fiber and it produces chemical substances such as enkephalins and endorphins. These are morphines. You know, morphine reduce the pain. That's why in hospital, if you have a high pain, the doctors will give you morphine to decrease the pain. And there are studies shows that when you have a proud movement or some other feelings, when you have an injury, these chemical substances are produced, and this is regulated by your emotional cortex. So when you do some mistake and you get beatings for your mistake, study shows that these chemical substances are not produced. This is also depends on your emotional cortex. This is how the pain is modified according to your emotions. The pain is transmitted, then it is received, and then it is modulated. This is the process of pain pathway. In dorsal column, you know, it is related with the sense of position, that is your external position of your hands, legs and your head. You know the position and you are aware when you are walking, sitting or running. But what about your position of your knee joint, your tension in the ligaments, your tension within the muscles, and the position of the joint capsules and the position of your muscle? You are not aware of these positions because these are inside your body. So this sense of position inside the body is transmitted by sensory nerve fibers to the cerebellum. The external sense of position, that is the position of your head, hands, legs, when you are running, sitting or walking, this sense of position is transmitted by the sensory nerve fibers to the cerebrum in the cerebral cortex. So this sense of position inside your body is transmitted to the cerebellum through spinocerebellar pathway, that is from the spinal cord to the cerebellum, that is spinocerebellar pathway. Please do not confuse cerebrum with cerebellum. This cerebrum, you see the top of the brain, that is cerebral cortex. This cerebellum is present in the posterior side, that is at the back of your brain. Now we will see this spinocerebellar pathway. You know, the sensory nerve fibers in anterolateral system, it will meet the second order neurons inside the spinal cords. In spinocerebellar pathway, from this second order neuron, the nerve fibers, it will go upwards from the same side, that is on the ipsilateral side, and it will go upwards to the cerebellum through inferior peduncle. So what is this peduncle? These peduncles are structures that connect the brainstem with the cerebellum. So you have superior peduncle, middle peduncle and inferior peduncle. These peduncles are white matter, it have axons. So this sensory nerve fiber from the second order neuron, it will go upwards ipsilaterally through the inferior peduncle to the cerebellum, and there are other sensory nerve fibers that will meet the second order neuron in the anterior lateral system, and it go to the opposite side, that is the contralateral side, and it will move upwards and through the superior peduncle it will go to the cerebellum, and again it will go to the ipsilateral side. Please do not confuse ipsilateral with contralateral. Ipsilateral means on the same side, contralateral means on the opposite side. So here for example, just take this sensory nerve fiber is on the right side and this is the left side. This sensory nerve fiber meet the second order neuron on the right side, and it goes to the opposite side, that is contralateral side, and it move upwards and through the superior peduncle it goes to the cerebellum and again go to the same side from where it started, that is the right side. This is ipsilateral side. This is the same on the other side also. Here the sensory nerve fiber on the left side, it will, after meeting the second order neuron, it will go to the opposite side, that is right side, and it move upwards and through the superior peduncle it go to the cerebellum and again to the same side from where it is started, that is the left side, that is the ipsilateral side. So in this pathway, these second order neurons are known as dorsolateral nucleus of Clarke. You can see this dorsolateral nucleus of Clarke from the vertebrae C8 to L3 vertebrae. C8 is the cervical vertebrae and L3 is the lumbar vertebrae and S3 is the sacral vertebrae. You can see the dorsal root ganglion, that is the first order neuron throughout the spinal cord, but this second order neuron, that is the spinocerebellar pathway second order neuron, that is dorsolateral nucleus of Clarke, only between C8 and L3. Above C8 you will see accessory cuneatus nucleus, because this dorsolateral nucleus of Clarke, as discussed in the dorsal column system, it will receive sensory nerve fibers from the lower part of the body, and This accessory cuneatus nucleus will receive sensory nerve fibers from the upper part of the body. Please do not confuse this accessory cuneatus nucleus with the cuneatus nucleus in the dorsal column. In the dorsal column, when you go back, you have fasciculus cuneatus and fasciculus gracilis. That is, fasciculus gracilis receives the sensory nerve fibers from the lower part of the body, and fasciculus cuneatus receive the sensory nerve fibers from the upper part of the body. And this fasciculus cuneatus and fasciculus gracilis will go to the nucleus cuneatus and nucleus fasciculis located in the medulla oblongata. That is different. This is called accessory cuneatus nucleus because it is near that cuneatus nucleus and gracilis nucleus. That is why it is called accessory cuneatus nucleus. It is near the cuneatus nucleus, but these two have no connection. It is different and it is different, and their functions are also different. So please do not confuse that. So below C8 you will see only first order neuron and the dorsolateral nucleus of Clarke, that is the second order neuron, and above C8 you will see the first order neuron and accessory cuneatus nucleus in the spinocerebellar pathway. And also see when these sensory nerve fibers go to the superior peduncle from both the sides, there is also a collateral connection to the reticular formation. You see the reticular formation in the whole brainstem. So whenever there is an ascending tract from the spinal cord to the cerebellum or cerebral cortex, you will have a collateral connection with the reticular formation. That's why reticular formation is the on and off switch of the brain. So these sensory nerve fibers going through this way, it is known as dorsal spinocerebellar pathway, and this sensory nerve fiber going through this way, it is known as ventrospinal cerebellar pathway, and the sensory nerve fibers coming from the accessory cuneatus nucleus, it is known as cuneo-cerebral pathway. And we also have discussed this before. There are some sensory nerve fibers that go to the Oliveri system and go through the inferior peduncle to the cerebellum, and that is known as Spino-Oliveri pathway. And while going upwards, some sensory nerve fibers will give connection to the reticular formation. This is known as spino-reticular pathway. So the sensory nerve fibers from the lower part of the body, from the dorsolateral nucleus of the Clarke, this pathway is known as from the spinal cord to the cerebellum, dorsospinal cerebellar pathway. And the sensory nerve fibers from the upper part of the body, that is the accessory cuneatus nucleus, are known as cuneo-cerebellar pathway, that is from the cuneatus nucleus to the cerebellum. Sensory nerve fibers that are from the second order neuron that go to the contralateral side in the anterior side, then move upwards, then through the superior peduncle go to the cerebellum and again to the ipsilateral side. These are known as ventrospinal cerebellar pathway because it is from the anterior side from the spinal cord to the cerebellum. And the other sensory nerve fibers from the spinal cord go to the Oliveri structures, and through the inferior peduncle it go to the cerebellum. This is known as Spino-Oliveri pathway. And while going upwards, these sensory nerve fibers will give a collateral connections with the reticular formation, and this pathway is known as spino-reticular pathway, that is from the spinal cord to the reticular system, that is reticular formation. So that's it for the anterolateral system. In anterolateral system you have pain and temperature pathway. The sensory nerve fibers from the spinal cord, it will go to the cerebral cortex, and there are also sensory nerve fibers in the anterolateral system that go through the spinocerebellar pathway, that is from the spinal cord to the cerebellum. So this is the summary of ascending tract. In ascending tract you have a major tract and a minor tract. In major tract you have cerebrum, tract going to cerebrum, and a tract going to cerebellum. And the minor tract consists of the minor pathways such as the tectospinal pathway, the olivospinal pathway, and reticulospinal pathway. The sensory nerve fibers from the spinal cord to the tectum located in the midbrain. The sensory nerve fibers from the spinal cord to the Oliveri structure located in the medulla oblongata, and the sensory nerve fibers from the spinal cord to the reticular formation while going or while moving upwards. And this, you have dorsal lemniscus system in anterolateral system, and the cerebellum. There are 3 pathways in the cerebellum, so please read this. So that's it for the ascending tract of spinal cord.